Oh, we're back, 8:13. Carson rejoins. Time for our series, Vaccinating America.
All right, guys, it is go time for Uncle Al. Now, Al, before you get your vaccination here, remind everybody how you qualify.
Well, I qualify because I am over 65 years old. So now, according to New York State, I could apply. And all weekend long, I went on the New York State health.gov website and kept logging in, had in my information, kept logging in. I finally hit pay dirt Sunday morning, and I got assigned here to Lenox Hill Hospital. And so that's how I made it. But it was a constant. I kept hitting refresh on the browser and finally got in, guys.
You just got to stick with it, I guess.
Yeah, because look, they put up a certain number of appointments each day, and then, luck of the draw. And so you have to keep going in. For example, I've got a brother, Chris, who runs New York City Health and Hospitals Metropolitan. He said, hey, you can come here. I said, I don't want to jump the line. I want to do this officially and above board. So I figured this was the best. And this was where I ended up, Lenox Hill Hospital, which just happens to be the place where both Nick and Leela were born.
Oh, sweet. Nice. Real quick, Al, I know a lot of people, and my mom included, we're trying to get appointments, and you can still hit it, and sometimes you don't get one till February, March, or April. Is there a way to try to, speed up the pace a little?
No, it really is where, depending on which facility puts on a number of appointments. They get the vaccine, they put in for those appointments. So if you're lucky enough, as I was, to get in now, it could have just as easily been February or March. But yeah. I lucked out.
They're going quick. There was 300 appointments at Lenox on Sunday.
Wow.
And from 9:07 to 9:15, they went like that. For the million plus, 65 and older in New York City, this is a tough thing, but we're glad you're there. What shot are you getting, Al?
Well, I'm getting the Pfizer vaccine. In fact, let me bring in Dr. Daniel Baker. He's the medical director here at Lenox Hill. So I'm getting the Pfizer vaccine, Doc. This is 2 vaccines spread out over 3 weeks.
Yes, over 21 days.
And I'm going to ask the question because a lot of people: is it safe?
Absolutely. We get asked that a lot, but the clinical trials really showed its efficacy, and we've seen hundreds of thousands of doses since, and everybody's doing rather quite well. So
a lot of people want to know, once you get the vaccine, especially after you get 2 doses, do I still need to wear a mask?
Yes, that's actually a key component of keeping us all safe. We're not going to know who has had the vaccine. We're also going to take some time in terms of getting up to enough people to where we can really take these masks off. So mask wearing is going to be with us for some time now.
Once I'm fully vaccinated, can I still be asymptomatic and spread COVID?
Yeah, that's a great question, and that's not what the clinical trials looked at. So we're hopeful the answer is no. As with most diseases, when you get some immunity, we're hoping you wouldn't then be able to then transmit it. But we're going to see as these things go, and we'll have a little bit more information coming.
A lot of people are saying, well, I'm going to wait until we get herd immunity, so I don't really need to get vaccinated. Pop that balloon for me, would you?
Yeah, that's a tough one because herd immunity really comes at about 85 to 90%. And the only way to get there is if everybody goes for the vaccine. We're going to get that 10 to 15% by people who couldn't get it because of a medical illness or something along those lines. So we all have to do our part. We have to go get the vaccine to really create that herd immunity.
So after I get this first dose, what am I going to feel?
So the first dose, you're going to feel a little bit of the soreness in the arm there. So not unlike the flu vaccine. But you're going to be up and on the Today Show tomorrow morning, no problem.
All right. And I know you got the vaccine, and when it first came here, you had mixed emotions.
Absolutely. It was very inspiring, incredible. It rolled right through the doors outside there, and we all stopped and actually took a selfie just with the box. It was just an incredible, inspiring, hopeful moment.
Well, I've got a hopeful moment now, thanks to Nurse Jessica Callard. Jessica, so I've answered a bunch of questions ahead of time, and so we're ready to do this?
Yes, we are.
Okay. So now, where do you do the vaccination itself?
So
it's to roll all the way up.
Yeah, it's pretty high. It's in your deltoid muscle, so it's just around here.
Okay.
Okay, and you answered no to all the questions. So,
right.
Do you have any questions for me?
Did you get the shot?
I did.
How'd you feel afterwards?
I felt good.
All right. Well, let's get ready.
All right.
The question is, will I get a Hello Kitty Band-Aid?
There we go. Uncle Al getting his vaccination.
Get the shot. Al, think about happy things.
That's right.
Puppy dogs.
There we go.
Pies and cakes.
Wow, look at Nurse Jessica.
Jessica.
Done and done.
That's excellent.
Wow, Nurse Jessica. What a pro. Thank you very much.
Uncle
it's a generic Band-Aid, ladies and gentlemen.
Oh, you got a Band-Aid, okay.
Oh,
Yeah,
sweet.
what did you want to know?
Well, I was too late now. I was gonna ask the doctor if the shot's more effective in the rear end, but it looks like it's in the arm now. So.
Carson wants to know, Doctor, could you have gotten it in the rear end?
Well, that answer is no.
Okay. Carson,
Deltoid.
All right.
Thank you. All right.
In the deltoid. See, I need some tats like Carson. That would have made this much better.
Yeah, there you go.
All right, Al.
We're happy for you, Al.
Glad you're feeling good.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.